Level 1, the pre-med, age 18. You're 18, you told your mom you want to be an OBGYN. She cried, happy tears. Your dad said, "You sure about all the," waves hand vaguely toward the lower half of his own body. "All of that?" He has not finished a sentence about the female reproductive system in 22 years. He starts one every Thanksgiving. He always abandons it. You're at UCLA pre-med track, biology, chemistry, physics, organic chemistry, and a biostatistics class that feels like it was designed by someone with a personal vendetta against your GPA. Your GPA needs to be a 3.7 or higher to look at a medical application, not to get in. To look, you meet a guy named Brad in your bio class. Brad has already memorized the APGAR score, the Bishop score, and the full pregnancy timeline by gestational week. He has not yet taken a single OBGYN class. He carries a copy of Williams Obstetrics in his backpack. He calls it Willie. You decide not to sit near Brad. The MCAT looms, 7.5 hours of testing. Biology, chemistry, psychology, critical analysis, graded out of 528. The average score of students who get into medical school is 511. You need to be above average just to be considered average. You take a practice test, you score a 496. You take it again, 498. 6 months of Anki flashcards, Khan Academy, and UWorld question banks later, you score a 513. You apply to 22 medical schools. You get into one. You call your mom. She cries again. Your dad Googles, "Is one medical school enough?" He still doesn't speak, but he nods once. That's his version of a standing ovation. Level 2, the medical student, years 1 and 2. You're 22. Technically, you are a medical student. Practically, you are a person who memorizes things at a speed that should be illegal. Year 1 is preclinical. Anatomy lab is week 1. You walk in. There are cadavers on every table. Brad is in your class. He shows up wearing scrubs 3 sizes too crisp. He immediately names his cadaver Geraldine. Your lab partner is a woman named Priya who can identify the inferior epigastric artery from across the room. You spend 18 months learning how every system in the body works, what goes wrong in each one, which drugs fix it, which drugs kill you if you give too much, and how to tell the difference. The pharmacology block alone covers 400 drugs. Half of them are used in pregnancy. The other half cannot go anywhere near a pregnant patient. You learn it cold. Magnesium sulfate for preeclampsia, methotrexate for ectopic, Pitocin for postpartum hemorrhage. The dose, the contraindication, the exact moment things go wrong if you confuse them. At the end of year 2, you take USMLE Step 1. It is now pass-fail, but passing is required to continue. You study for 6 weeks straight, you pass, you do not celebrate, you immediately start studying for the next thing. There is no finish line in medical school. There is only the next threshold. Level 3, the medical student, clinical years. You're 24. Years 3 and 4 are clinical rotations, 6 weeks each, internal medicine, surgery, pediatrics, OBGYN, psychiatry, family medicine. You touch patients now. Every attending is different. Every hospital is different. You are the lowest person in the room. Your OBGYN rotation is in your 3rd year. The first day, you walk onto labor and delivery at 5 a.m. The board has 14 patients. 3 are in active labor. 1 is being prepped for an emergency C-section. The attending is Dr. Reina. She is 5 feet 4 inches and the entire floor goes quiet when she walks on. The patient is a 31-year-old woman named Mariam who is hemorrhaging, placenta previa, the placenta covering the cervix, ripping open as labor progresses. The decision to delivery time for an emergency C-section is supposed to be 30 minutes. Dr. Reina gets it done in 18. You watch from the foot of the OR table. You see the uterus open. You see the baby pulled out, stunned and crying. You see Dr. Reina control the bleed with her hands and 3 sutures. She does not speak for the entire procedure. She does not need to. After the case, in the hallway, she pulls down her mask. She asks you one question. What did you observe? You answer for 2 minutes. She listens. She says, hands first, words later. Then she walks off to her next case. You decide, standing in a hallway smelling of antiseptic and amniotic fluid, that this is what you are going to do with your life. You take USMLE Step 2. You score a 254 out of 300. High enough. You apply to OB/GYN residency. There are about 1,500 spots in the country, around 2,000 applicants. You are not guaranteed anything. Match day arrives. You sit in a room with your entire class. Everyone opens their envelope at the same time. You match at Cedars-Sinai in Los Angeles, one of the top OB/GYN programs in the country. You read the letter twice, then a 3rd time. Level 4, the intern. Age 26, you're 26, intern year, the first year of residency. It is designed, as far as you can tell, to eliminate any remaining illusions you had about sleep, free time, or the phrase, I'll eat when I'm done. You work 80 hours a week on paper. The 80-hour rule exists. It is respected the way speed limits are respected, technically, in principle, with notable exceptions. Your senior resident on the first night is Dr. Khan. She hands you a list of 18 patients on the postpartum unit at 4:47 a.m. and says, know everything about every one of them by 6 a.m. rounds. You pre-round every morning. Vitals, fluids, output, lochia, fundal height, breastfeeding status, who hasn't peed yet. If Dr. Khan asks you something you don't know, the answer is never, I don't know. The answer is, I'll find out and have it to you in 10 minutes. The pager goes off constantly. It goes off when you're brushing your teeth. It goes off when you're inhaling a granola bar that has been in your locker for 11 days. It goes off in the elevator. It goes off in the bathroom. It goes off when you are calling your mother for the first time in 6 weeks. You hang up. Your attending is Dr. Marquez, 30 years on labor and delivery. The kind of person who does not blink during shoulder dystocia. She delivers babies the way other people parallel park. You ask her a clinical question on day 3. Dr. Marquez looks at the chart, then at you, then back at the chart. She says, babies don't read the textbook. 3 hours later, the patient delivers in 47 minutes. You deliver your first baby at 2:47 a.m. in the 3rd week. The mother is a 28-year-old named Joelle, who has been in labor for 19 hours. The baby crowns. You guide the head. You feel a brand new human slip into your gloved hands. You put the baby on Joelle's chest. Joelle is crying. Joelle's husband is crying. The nurse is crying. You are not crying because Dr. Marquez is in the corner watching. You will cry later in the call room, alone, for about 90 seconds. A patient crashes at 3 a.m. Postpartum hemorrhage. The uterus won't contract. Blood is everywhere. You are the first responder. You call Dr. Khan. She talks you through it on the phone while running to the floor. By the time she arrives, you've started the Pitocin drip, called the blood bank, and started uterine massage. She looks at the chart, then at you. She says, reasonable. From Dr. Khan, that is a 5-star review. Level 5, the junior resident, PGY2, age 27. You're 27. You now supervise the intern. This is the first time in 5 years someone looks at you for guidance. It is thrilling. It is terrifying. It is mostly terrifying. You start performing C-sections as primary surgeon, supervised. Your first one is uneventful. Your second one isn't. The patient is a 24-year-old at 26 weeks who came in with a sudden placental abruption. The placenta tearing off the uterine wall, a catastrophic obstetric emergency. The fetal heart rate is decelerating. You have minutes. Dr. Khan is on the other side of the table. You make the incision. You pull the baby out. The baby is small, 920 grams. Limp, blue. The NICU team takes her immediately. You finish the surgery. The mother survives. You don't know yet if the baby will. You start reading the literature, not because anyone tells you to, because the questions you're seeing in the OR don't have clean answers and you want to find them. You read on the bus. You read while eating. 3 weeks after the abruption case, the mother, her name is Daniela, finds you in the workroom. She hands you a Polaroid. Her baby in an isolette with a tiny CPAP mask. On the back, Daniela has written one line. She walks now. She doesn't walk yet. She is 3 weeks old. Daniela means she will. You put the photo in your white coat pocket. You see your first stillbirth on a Thursday afternoon. The patient is at 38 weeks. No heart tones. You deliver. There is silence in the room where there should be a cry. You stay with the family for 90 minutes. You don't speak. You don't need to. Dr. Khan finds you afterward in the workroom. She says, take 20 minutes. You do. Level 6, the senior resident, PGY3, age 28. You're 28. You run labor and delivery on overnight call. The intern calls you. You call the attending only when necessary. You are the layer between panic and action. Your surgical volume grows. Ovarian cysts, ectopic pregnancies, fibroid resections, complex hysterectomies. You run shoulder dystocia drills with the team monthly. You know the McRoberts maneuver, the wood screw, the Rubin maneuver. You can perform them in the dark. You have twice. A placenta accreta case comes through. A 33-year-old woman, 3 previous C-sections. The placenta has grown into the uterine wall and won't separate after delivery. Estimated blood loss potential, 5 liters. Massive transfusion protocol on standby. The case is run by Dr. Hallberg, a maternal fetal medicine attending who flew in from UCSF for this specific kind of case. You scrub in. The case takes 5 hours. The patient receives 14 units of blood. Dr. Hallberg performs a hysterectomy to control the bleeding. The patient lives. In the locker room afterward, Dr. Hallberg pulls off her cap. She looks at you. She says, "You're going into MFM, aren't you?" It is not a question. You say, "I think I am." She says, "Good. Apply to UCSF." She doesn't wait for an answer. Level 7, the chief resident, PGY4, age 29. You're 29. 4 years of residency. You are now the one who runs the service, manages the schedule, mentors the juniors, and operates at a level most OBGYNs spend a career reaching. Dr. Marquez, your first attending, the babies don't read the textbook woman, gives you the most complex case on the board. A 38-year-old at 31 weeks with severe preeclampsia, HELLP syndrome, fetal growth restriction, and a fibroid the size of a grapefruit, blocking the lower uterine segment. She scrubs in with you. She does not touch the instruments. She watches. 3 hours. The baby is delivered alive. She cries on the warmer, weak but real. The mother survives the surgery, the magnesium drip, the hemorrhage. You preserve fertility. You preserve everything you can. Dr. Marquez finds you afterward in the hallway. She says 4 words. "You don't need me." 4 years. 4 words. You don't need more than that. You match into MFM, fellowship at UCSF. Dr. Hallberg's program. Level 8, the fellow. Age 30. You're 30. You chose to subspecialize. Maternal fetal medicine. High-risk pregnancies. Fetal surgery. Twin-twin transfusion syndrome. Placenta accreta spectrum. Fetal anomalies that require intervention before birth. 3 years of fellowship. UCSF. The program is run by Dr. Hallberg, who schedules teaching rounds for 5:30 a.m. on Saturdays. Not because the hospital requires it, because she does. You perform your first fetoscopic laser ablation. The procedure, a 24-week pregnancy with twin-twin transfusion syndrome. 2 babies sharing 1 placenta with unbalanced blood flow. 1 twin is getting too much. 1 is getting too little. Without intervention, both die. You navigate a fetoscope through the mother's abdomen, through the uterus, into the amniotic sac. You cauterize the abnormal connecting vessels on the placenta. Both twins live. Dr. Hallberg says, "Acceptable deployment. You have learned that acceptable means excellent." You publish 3 papers during fellowship. You present at SMFM, the Society for Maternal Fetal Medicine annual meeting. Someone in the audience asks a question about your data. You know the answer before they finish the sentence. The fellowship ends. Dr. Hallberg shakes your hand. She says, "Let's do it again." She means, keep going, keep getting better. The weight of it is enormous. Level 9, the attending, age 33, you're 33. Your name is on the door. Dr. Ellis. Attending OBGYN, maternal fetal medicine. You have your own patients, your own OR days, your own residents who look at you the way you once looked at Dr. Reyna. Your first patient as the primary surgeon is a 41-year-old woman named Ren, pregnant with twins after 8 years of IVF. 1 twin has a congenital diaphragmatic hernia, a hole in the diaphragm that allows abdominal organs to herniate into the developing chest, compressing the lungs. Without fetal surgery, survival is 50%. With intervention, it rises to 75%. You perform the procedure at 27 weeks. It works. Ren delivers at 35 weeks. Both babies live. You build your practice. You take the cases other MFMs send away. The placenta accretas, the pre-viable proms, the fetal anomalies at the edge of viability. You take residents into the OR and you teach. Not because the hospital assigns you to, because Dr. Reyna once stood in silence while you decided something was your calling, and the least you can do is give someone else that same room. Level 10, the department chair, age 52. You're 52, you chair the department of OBGYN at Cedars-Sinai, where you trained as a resident 27 years ago. Your CV is 42 pages, 187 peer-reviewed publications, over 9,000 deliveries, over 600 fetal procedures. You have trained 28 fellows now practicing across the country. 3 of them chair departments of their own. The hospital is expanding. New fetal therapy center, new simulation lab for residents, AI-assisted prenatal screening platform. You fought for the budget, you won. You always win eventually, because you do not mistake urgency for speed. You learned that from Daniela, actually. From the Polaroid. She is almost 24. She just matched into OBGYN residency at this hospital. She introduced herself last week in your office. I think you delivered me, she said. You pulled the Polaroid out of your white coat pocket. I know I did, she cried. You did not, because you had a meeting in 8 minutes. You still operate 2 days a week. The cases you keep for yourself are the ones the residents call impossible. You don't believe in impossible. You believe in insufficient information. A third-year resident, Dr. Sato, scrubs in with you on a placenta accreta case. She is technically gifted. Fast hands, but when the unexpected bleeder appears, she freezes. Half a second, not long, long enough. You control the bleed without interrupting the field. Afterward, you debrief her. You say, the hands know what to do. The job is to let them. She writes it down. You walk out of the OR on a Thursday afternoon in June, past the postpartum unit, past the resident lounge where someone has drawn the stages of labor on a whiteboard with a small note. Do not erase studying. You do not erase it. You have spent 34 years learning how to bring people into the world, sometimes against the world's permission. You have held first heartbeats on ultrasound. You have closed wombs around babies still developing. You have stood at the edge of what is possible and stepped past it enough times to know that the edge keeps moving. Some of the babies you delivered don't know your name. That's fine. You didn't do it for the name. Daniela still sends a Christmas card every year. It always says the same thing. She walks now. 3 words. Every year. Still enough. Before we go further, hit the like button right now and subscribe because we drop a new one every week.